This is an introduction to the nursing profession. So what is nursing? What are your assumptions about what nursing is, and what is the actual definition of nursing practice? Nursing concerns itself with the human response in illness, both in illness and in wellness, so in health as well. And nursing creates its own diagnosis to plan nursing care for patients, so to plan nursing action to care and support the person as they are going through, whether it's a surgery or a diagnostic process or anticipating death or birth or any of life's natural processes. How does that differentiate between what medicine does? Nursing collaborates with medicine. Nursing reports signs and symptoms and tracks and monitors and so on and so forth, and collaborates with medicine in that way. But medicine and nursing's diagnosis are unique. Medicine diagnoses disease, and medicine concerns itself also with caring for patients, but with curing that disease. Nursing is really knowledge work, and it's more important for you at early stage in your nursing career is to understand that it is knowledge work, that it is necessary to be able to synthesize and analyze data to be able to create the nursing care plans that need to be put into place for patients. And so try not to get totally a task focus. There are a lot of psychomotor skills that are essential to have, whether it's starting IV or giving a shot or reading an EKG, but that just contributes to your ability to use knowledge to plan care for your clients. So it's not just a series of tasks. In order to be considered a profession, an occupation needs to have its own unique body of theory. And in nursing, we call it the evidence basis for nursing. What does the research say? What are the best actions to take that will be effective for most clients most of the time? Once a theoretical body of knowledge is created, then in order for new people to join the profession, they have to become educated, hence nursing school. All professions have some mechanism for having service to society, and indeed nursing is one of the noble occupations that does serve society. Nursing is autonomous in the sense that the way that nursing is governed is by nurses themselves. So people aren't telling us how to run our occupation or our profession, but that is our responsibility to manage both the knowledge and the training and etc. ourselves. All professions have a unique code of ethics, and nursing is not different from that. And one of the classes you'll take actually looks at ethics in nursing and what are the issues there. In order to know how to proceed in patient care, there must be a standard code, if you will, or a set of procedures that are approved so that we can show that we are training people to do things based on the evidence. So there's definitely a code, if you will, for nursing action. So where do these different codes reside? Well, each state in the United States has a state board of nursing, and there is also in each state an actual law called the Nurse Practice Act, which dictates what we can and cannot do. The Board of Registered Nurses in each state are nurses who sit with a legislative body to determine how nursing will be enacted in that state. And so when you are completed with your nursing education, you will sit for the state board exam, and you will therefore, if you're passed and successful, you will then become licensed as a nurse to be able to practice. So we talked about there being codes of ethics and standards and so on. So in a way, once you are licensed, you now have a right to be a nurse, so you have a right to start that IV, you have a right to give that shot or plan that care. And then on the flip side of that, with rights come responsibilities. So you are now obligated to plan that patient's care and to diagnose and treat that human response to wellness and illness. In addition, you may notice that some nurses have become certified. And to become certified means that in addition to having a state license, they prove their expertise by taking a national exam set by one of the professional nursing societies in a given topic, for example, critical care or maybe the operating room. And this is a way of showing a specific level of quality and education beyond that of a graduate from a nursing school. You will find both in your nursing education and as a graduate nurse when you begin your first job that there's a continuum known as the novice to expert continuum. So clearly when you start out and you hit the hospital on the first day, you're a beginner and you won't know much and you won't know how to do things and so on. But over time you'll be gaining more knowledge, more skills, more experience, and by the end of this certainly you'll be an expert nursing student. But that continuum will begin again once you graduated and gotten your license and begin your hospital practice. Now you will begin again as that novice nurse who doesn't have some faculty member beside them supervising them and helping them make their judgments and so on. And in actual fact, they say it takes 3 to 5 years to become an expert nurse. How do nurses make those diagnoses? How do they create nursing care plans? Or one way of looking at it is almost like a recipe to care for the patient. So you're making your own, in a sense, list of what you're watching in the patient, but communicating to your peers who are collaborating around the clock to care for that person. How will you do that? Well, it's best to do it in a systematic fashion. And that systematic fashion is known as the nursing process. And this is a 5-step process. And the steps are assessment, diagnosis, planning, implementation, and evaluation. The acronym for this is ADPI, and we're going to go into that in depth in the next lecture to understand what each of those terms are and how to apply them.